How does post-exertional malaise, PEM, distinguish me from CFS? Imagine feeling perfectly fine one moment, then suddenly experiencing a wave of worsening symptoms after doing just a little activity. That's what post-exertional malaise is all about. It's a key feature that helps tell myalgic encephalomyelitis apart from chronic fatigue syndrome as traditionally understood. PEM refers to a significant worsening of symptoms that happens after physical, mental, or emotional exertion. What makes it unique is that this worsening doesn't happen immediately. Instead, it often appears 12 to 48 hours later and can last 4 days, weeks, or even longer. This delayed and prolonged response can severely impact a person's ability to function day to day. In medical guidelines used by major health organizations like the Institute of Medicine, the National Institute for Health and Care Excellence, and the Centers for Disease Control and Prevention, PEM is considered a core symptom for diagnosing myalgic encephalomyelitis and chronic fatigue syndrome. It involves a marked and disproportionate increase in symptoms such as fatigue, cognitive issues often called brain fog, pain, and feelings similar to the flu after minimal activity. Importantly, this reaction isn't relieved by rest, which is different from the normal tiredness most people experience after exercise or a busy day. The main ways PEM helps distinguish me from CFS are in its severity and duration. In myalgic encephalomyelitis, PEM causes a major relapse that can last days or even weeks, with symptoms spreading beyond just fatigue to include cognitive difficulties, sensory sensitivities, and pain. In contrast, the fatigue seen in CFS tends to be more transient and less likely to cause such a profound or prolonged worsening. Another important point is the delayed onset of PEM. Unlike normal tiredness that appears right after activity, PEM symptoms often show up hours or even days later. This delay makes it harder for patients to predict or manage their activity levels, leading to what's called post-exertional worsening. Scientific studies using 2-day cardiopulmonary exercise testing show that people with ME have a significant drop in their maximum oxygen consumption and overall exercise capacity on the second day, which is not seen in healthy individuals or those with other fatigue conditions. This provides objective evidence that PEM is a real physiological phenomenon, not just a subjective feeling. PEM is also characterized by a complex set of symptoms. Beyond fatigue, individuals often experience cognitive impairment, unrefreshing sleep, muscle and joint pain, and immune system abnormalities. While chronic fatigue syndrome as a broader diagnosis may include fatigue and some overlapping symptoms, PEM's presence and pattern are what really set ME apart. Modern diagnostic criteria for ME and CFS emphasize PEM as a mandatory symptom because of its central role in the illness. Earlier definitions focused more generally on ongoing fatigue without requiring this specific post-exertional worsening. Recognizing PEM helps clinicians make more accurate diagnoses and tailor management strategies. In summary, although both ME and CFS involve long-lasting fatigue, it's the presence of post-exertional malaise that truly distinguishes ME. Its severity, delayed onset, extended duration, and measurable physiological impact make it a defining feature. Understanding this difference is vital for proper diagnosis, treatment, and support. Remember, everyone's experience with these conditions can vary, so always consult healthcare professionals for personalized advice and care.